we cut to the chase on pelvic floor dysfunction and how to fix it. So once again, I'm Maddy with Forte Strength and Fitness Training, and we had
Andrea, pelvic floor PT.
What's the name of your practice again? So people in Whitesboro area can go check it out.
Bold Move Physical Therapy.
Bold Move Physical Therapy. We love to hear that. We love a woman-owned business.
So yeah.
So how long have you been doing this?
So I graduated PT school in 2022, and I worked for somebody else for a few years, and then I officially opened my business in April of this year, so about 7-8 months.
That would be the possible. Congratulations on owning your business. So we're going to talk about pelvic floor health, well-being.
Yeah.
Health. Okay, we're going to talk about the pelvic floor today and how it translates into training and just life overall, life quality. So first off, can you start by telling us what is the pelvic floor?
Yeah, so the pelvic floor, well, it's a muscle group that's at the bottom of your intra-abdominal cavity. Basically, that's the definition of it. But kind of when I'm working with women with pelvic floor dysfunction, it's not always just the pelvic floor that has the issues, right? It's kind of anything from like here down, all the way down to your feet, yeah. And so when I'm working with women, we're looking at posture, we're looking at strength, we're looking at how different muscles are like interacting with each other, if there's weakness, if there's pain, if there's too much flexibility, all that good stuff.
Yeah. Okay. So what have you noticed, or what can you tell us about some of the research that there is? What causes pelvic floor dysfunction?
Yeah. So vast majority of my clients either are pregnant or postpartum. That's like, I would say like 90% of them for sure. Other than that, I work with women who have hit menopause, and so the hormones are changing. There's different stuff going on there. Other than that, there's quite a correlation between like athletes and having like hyperactive pelvic floor muscles. So that leads to pain. It can lead to incontinence, other symptoms like that.
That's actually really interesting. So coaching cross-country track and field, so some of my longer distance girls on the track, like they'll have a race and I feel like I had to pee the whole time, but I went right before my race. Like, oh, yeah, okay. I mean, like maybe you're nervous and you're like, oh, it's just weird. It gets uncomfortable. So it's interesting that it could be.
Yeah.
Is it a weak pelvic floor? Is that?
So it's getting into the nitty gritty of
Ooh,
it now.
okay, hard hitting question.
Yeah. So that's like really the long distance runner. As far as athletes go, like that's the epitome of like hyperactive pelvic floor for sure.
Okay.
Because with that long distance running, that's a lot of time that these postural, like abdominal pelvic floor muscles have to be turned on and worked and contracted basically. So from there too, you also end up having like tightness in hip flexors. Quads.
Yeah.
They're, like I said, they're quad dominant. They might have weak glutes, different things like that. So when you have muscle imbalances in different parts of the glutes or the core or whatever, pelvic floor muscles, hip muscles love to tighten up and give you some issues there. When you have a shortened pelvic floor or tightened pelvic floor, it can be weak, but that will give you those symptoms of like urgency. So that feeling of, oh my gosh, I had to move back the whole time. Frequency, I need to go often, different things like that. Yeah.
That's crazy.
Yeah.
How it actually connects that.
Yeah.
So is a tight pelvic floor the same as a hyperactive pelvic floor?
So yes, I mean tight, quote unquote, is not like the scientific term. So like a hyperactive pelvic floor, an overactive pelvic floor, or a short pelvic floor.
Okay.
So your muscles kind of like to, like very crude demonstration, but muscles like to hang out in this position.
Okay.
So those muscles can either be like lengthened, or they can be shortened like that. Does that make sense?
Yeah, definitely.
Yeah.
So for people who are, not menopausal or they haven't carried or previously carried, pregnancies, is the treatment the same? Is it similar?
Yeah,
or is there some like differences there?
It really depends on so anybody at any age range can have any of this stuff going on. It's not like younger women tend to have hyperactive pelvic floors or older women have like lengthened pelvic floors. It can go either way. How does treatment differ? So basically, as any PT does, like no matter what part of the body you're treating, you're really just treating like what the symptoms are when they come in. So like part of my job is like sitting here listening to them in their evaluation and just like hearing, okay, they've been through this, that, and the other thing. Their symptoms are X, Y, and Z. And then so my brain and my mind starts to think, okay, not that I put patients in boxes, but are we leaning towards like things are like lengthened out and we're weak because of that? Did trauma happen? Is it shortened? That type of thing.
Okay.
So then like say somebody has a hyperactive pelvic floor, like we were already talking about, my treatment then goes towards like breathing, stretching, down training, relaxation to get rid of the symptoms there, like pain, urgency, frequency. They can have incontinence, stuff like that. If it's towards like the lengthened or like more relaxed side, then you're looking at like trying to engage those muscles, like finding targeted exercises that work specifically for that person to improve the strength of their core pelvic floor. Is there something about?
So that's really cool.
Okay.
No, I think it's so interesting because it's one of those, I don't want to say niche, but it is. It really is. Because, you know, going through, like, I have a master's in sports science and rehabilitation. So it's like, that's not a topic that's really hit on.
Yeah, talked about
unless you're specifying in practice, you know.
Yep.
So it's really cool.
It's funny that you say that though too, because we really don't talk about it in like like entry level PT school. Like you don't. Like I think probably like maybe a week, maybe a couple days was kind of focused on like women's health, pelvic floor stuff, and that's it. And so from like once you get that entry level degree, then you need to keep going either through the American Physical Therapy Association or what's called Permanent Walls Pelvic Rehabilitation Institute, which is the route that I chose, and take continuing education classes so that way that you know how to evaluate and treat this type of stuff.
That's so cool. That's baller. Like to say that I did this all extra studying, extra education. It's really interesting because is it a high percentage of females that experience pelvic floor dysfunction? I feel like that's pretty common, and we wouldn't even know.
I know. Statistics number wise, I have a couple of them floating in my head, but as far as like women, like 1 in 4 women will experience pelvic floor dysfunction. So at some point throughout their lifetime, so 25%. But if you think about like the kind of stuff that I'm treating, like it can be embarrassing and it can be like kind of scary to ask for help for a couple reasons because either a lot of the times, unfortunately, like in my practice, I've seen like providers do not listen to women. So
facts, all facts.
Even to just like tell your provider that you're having this issue. Other studies aren't really. We don't have a lot of studies on women.
Have you tried birth control? Have you tried birth control?
I want to write a book about like
do it.
All of the like the reasons that like my patients have been told that they're having these issues. Like they come in and their doctor just gives them the most ridiculous reason.
Run around answers.
Like I just can't even.
Try sleeping more. Try drinking more water. Try birth control. I think you're anxious. Like.
Or this is just like how it is. Like because you're a woman, it's like this is it. No, far deep into. I don't have. TMI doesn't exist.
This is a safe space. Forte's a safe space. Let's hear it.
TMI doesn't exist with me, but so I mean everything from like you're a woman, you're old now, you had a baby, you're overweight, you just need to use a lube, have a glass of wine, you're fine. Like what?
It's like okay, but why? Like that doesn't fix anything.
Exactly.
It's just masking the symptoms. It's like saying, oh my gosh, my quad is like in so much pain. Oh, put biofreeze on it. Slap some Mountain Ice on it. It's like it's a tear, but okay.
No, I know. And I don't. It's old school thinking for sure. And in Utica, New York, like that's kind of the way it is. I've also it's like when I was a student. I was fortunate enough to be at Upstate University to like learn this stuff. I had the best clinical instructor ever. But their like thought process behind like just women's health in general, even in Syracuse, literally an hour, not even away. Miles ahead of Utica. So that's really something that's important to me because like this is home, like I'm from here, and I just want there to be better treatment for women,
better education too.
That too. Literally. Exactly.
That's so cool though. It's so true. Thanks. And I think this is a huge just tip of the iceberg of, especially with female athletes. What they have to deal with, what they go through and, like body dysmorphia, menstruation, female athlete triad. Like everything is so connected. And I mean, like, what sports, like you said, long distance running is
For sure.
one of them. Are there other sports that are more hit by this, or?
That I've worked with. As far as pelvic floor stuff, for runners for sure, I've seen a huge correlation. And with, I personally do CrossFit, so I'm like kind of in that community, and those women they see double unders and they're running to the bathroom before the workout to make sure that they have emptied their bladder. Heavy lifting.
I can tell you, like, whenever I pull heavy, like whether I was in prep or I was at a meet, I'm like praying, like, okay, I just went to the bathroom, like, I'm good, I'm good. I'm like, okay, fingers crossed. But it happens, like, I've seen it happen. And, I mean, in that environment, it's just kind of, you know, like, normal. But where if you're anywhere else, you get that feeling and you're like, this doesn't feel right, this is wrong. But
it's not normal in that setting. Like, you should be able to.
You shouldn't experience that, but it's something where it's like, oh, it's just part of it. It's like, it's not, like, who said that's normal?
If a male was deadlifting really heavy and they just like, there's just no way. They would look at you. There's just no way.
So weird.
So running, CrossFit athletes, like powerlifters for sure. Gymnasts, dancers, because in those sports that hypermobility of like spine and hip muscles is like really desirable. So what you have happen there, again, it comes out to like muscle imbalances and stuff like that. Your body perceives that extra mobility as a threat, and so it can tighten other things up.
Wow. That's crazy. That's interesting, and I feel like that hyper flexibility, hypermobility kind of translates into so many other sports too, whether it's like track and field, high jump, you know, where you really have to arch, and it's interesting how broad it actually touches and people wouldn't know. So would you say it's very underdiagnosed? Do you think it really is more than one in four?
1,000%, yes. So kind of getting back to like, it's embarrassing to talk about. We have terrible studies for females in general.
Lack of studies.
Yes, exactly. And like, do we actually believe females half the time? Like, not, you know, like literally the word hysterectomy, right? That's removal of the uterus. Comes from the word hysteria, which means you're crazy, right? Like, even our language around like
the
this
root
type
of the word.
stuff is just like,
that's insane.
So literally, right?
That's insane. I think really breaking it down that way, it's crazy, and it's hard to have, you know, those kinds of conversations for a lot of people, for sure. But I think that really goes to say a lot about, you know, female coaches and having good mentors and having, you know, just people around you that you really trust. That's crazy. I think it's so understudied that it
is. I know. It's so, and especially like in this area. So I think there's a huge possibility that I could be wrong, but I think I'm like 1 in like 3 from like Syracuse to Rochester that does.
It's not advertised, so that wouldn't surprise me. It's really not something you see too much of.
And there's been like so many women who've been like, I've had this for years and I had no idea, and it's just like so frustrating to even like, you know, so your orthopedic PT even treats shoulders, elbows, knees, all that good stuff. Like, every single day, patients are running through ortho practices or primary cares, and they're being like shuffled to, okay, go to PT for your pain. Thing. You got a shoulder surgery, you're going to PT, right? That does not happen for them at all. And it's so frustrating because like, I know that they're seeing these patients who every single day are having these issues, and it's like, I have to like fight for referrals sometimes for these patients, because even OBGYNs, primary cares, different like medical doctors don't see what I do and like think that it should help. Basically, does that make sense?
It does. I mean, it doesn't.
It does.
But I understand what you're saying.
For sure.
Oh my gosh.
So there's that.
So we talked about, you know, fixing muscle imbalances and strengthening your core 100%. Are there other things that you can do to fix it?
Depending, so
everybody's different.
It goes back to like what actually is like the issue, right? I'm a very, very like hands-on manual therapist, which is why part of a huge reason why I started my own practice to begin with, because before that I was seeing like 20 patients a day, and I would be responsible for watching 4 different people, and it's just like there's no way that I could be the therapist that I wanted to be.
Yeah.
And so now all my sessions are one-on-one for an hour, and I can, like, they get better quicker because I can put my hands on them if I need to.
Yeah.
I can say that I'm actually watching them and saying, this is specifically what you need to do.
Yeah.
Different things like that. So manual therapy, just kind of like getting back to that, like that goes into like pretty much every treatment plan that I have.
Right.
If somebody comes in, even thinking like they're not really here for pain, 95% of women who have pelvic floor dysfunction have I messed up. 95% of women with low back pain have pelvic floor dysfunction. So, and like, so you're always, at least how I like gear my treatment is like, okay, we're fixing the pain and discomfort first, quiet the nervous system down, and then we're going to rebuild and prepare better.
Yeah.
So
that's
no.
So that's crazy because you really think about those symptoms and people experience that a lot, and like you said, it's not pain, but like, oh, with lower back pain could be
exactly.
So are there other symptoms people might not think could be an indicator of pelvic floor dysfunction?
Yeah, for sure. So I see a lot of hip pain, low back pain. Tons of times when patients come in, they'll like just
is it that secret that
like, oh, this hurts a little bit. It's like, okay, well, like, let's get rid of it.
Yeah.
Simple. Trigger point release, done. Like, they're walking out, new lady. Honestly, so, and then other symptoms, what were we talking about? Oh, goodness. So,
so many symptoms.
I know. So, a lot of it's that incontinence. So, like, leakage, basically. Urinary urgency, frequency, constipation is a huge one.
I would not have thought that.
So I help women with that. Menstrual cramps, pain and stuff with that. What else is going on? Pain with intercourse.
Yeah. So is there, you touched on cramping.
Yeah.
Is there a correlation between endometriosis and pelvic floor dysfunction, PCOS and pelvic floor dysfunction, or is that just something that's not studied?
No, it is studied, but not well yet. Hopefully that we can kind of keep that going more, but for sure. So something like in both of those diagnoses are inflammatory. So something like endo, like I said, inflammatory, you have that rapid like growth of scar tissue. The body perceives that as an injury or a threat, basically. And so what it does then is it ends up, typically we see that hyperactive pelvic floor like shortening because your body is like, oh my gosh, something is happening. Like, like in this very vital area of my body, like this stuff needs to be okay for me to like continue to live. So it is like holding everything together as much as I can.
Wow. No, it's so interesting because it's stuff like, you know, cramping, like, oh, birth control.
Yeah.
Oh, you know, like,
that's another
digestion suffering, birth control.
Yes. The different stories I've heard too of like, okay, like hormonal birth control or like whatever treatment that a medical doctor put somebody on that led to like tumors or led to, you know, pill-induced like PCOS or like other things, like slapping a Band-Aid on it and it's not fixing it and it's actually making problems worse.
Yeah, it's just a Band-Aid and it's not even a good one.
Yeah, it's not even a good one. It's not even a good one.
So what would you want the takeaways to be for people who are just hearing, you know, about, I feel like we hear pelvic floor thrown around in social media, want to be influencers and stuff, and it's just like, oh, do this for your pelvic floor. It's like, what is really the key takeaway that people should be aware of?
Yeah, for sure. I guess like my biggest thing I say over and over again is that all of this stuff it's common, but it's not normal. And so a lot of people deal with it, but that doesn't mean that it's a normal part of life and you should not have to be dealing with it. There's so many studies about the efficacy of pelvic floor PT, and honestly, I see it in my practice every single day. There's never not once been a patient that's left my practice and I can say I did not help this person, at least in some capacity. So just like biggest thing is like, it's not because you're a woman, it's not because you had a baby, it's just what your body is doing right now, and there's ways to fix it, and let's do it.
Let's fix it. All right. Awesome. Okay. Well,
and I set that pelvis where we want it to be. Did I answer the question?
Yeah, that was really good.
That was really good,
That was
yeah.
really good.
I like that.
I'm a doctor.
She's like, I'm gonna throw that out there one more time. I am a doctor.
Awesome.
I love that you mentioned the hip bridge though, because when you actually isolate, like that helps with lifting too and creating good
For sure.
form. 100%. You did that with me back in the day when you were my PT years and years and years ago because my back was messed up. And like I bumped it in my quad. I literally had a full quad tear in my rectus femoris and it was horrible.
That sounds good.
Sad because you're like, why are you arching so much? I don't know.
That little stuff with athletes so is like important. Like even, I mean, think of how much hip it is for hockey. How crazy. Softball, any of them.
Don't.
Thank you. I'm practically exactly.
Good.
Okay, I feel like if you Google pelvic floor on like the internet,
Yeah.
or Kegel is actually beneficial.
This is a
I
long.
feel the
How
best at this.
much time have we got? How much time have we got?
Check cameras.
So a couple things. So I have many soapboxes. Kegels is one of them. Okay.
That's okay.
So
That's okay.
So I don't use the word Kegel for a couple of reasons because it was named after a man, and I think that's super foolish.
That's
I'm
bullshit.
so over it.
I agree. I agree.
The other thing is that that Kegel, that exercise has been coined like squeeze your pelvic floor and like never let it go. If I've been sitting here talking to you for like 40 minutes now and holding my fist like this, like by now I'd be like, Maddy, oh my God, my hand is killing me.
Yeah.
So if you are just focusing on like the contraction and not the like lengthening of that muscle, this not gonna work, right? It's gonna make things worse. The other thing is too is that people think like anytime they have pelvic floor dysfunction, whether it's incontinence, or C frequency, whatever it is, like do Kegels. And it's like, no, because if those muscles are already in a short position, it's gonna make it worse.
That actually brings up a really good question. Is there a high correlation? Say, I mean, they probably do have some symptoms of pelvic floor dysfunction prior to pregnancy, but like post-delivery, if they do have a husband stitch, which I hate that term, but like I hate that.
That's new to me.
Do you know what that is?
Like, can you define
We're gonna
it?
teach you something.
So say there's any ripping during delivery, say, or an episiotomy, right?
Yeah.
It's an extra stitch, like, so they suture it where it's tighter and then it's smaller than it would have been prior to delivery. And and there has been lawsuits. There's been research on this because there's like psychological trauma because now intercourse is going to feel completely different and so uncomfortable.
Right.
I wonder if there's any research about correlation between husband stitch post delivery and like increased or new pelvic floor dysfunction.
Well, I can tell you absolutely 100% you're going to have dyspareunia there, which is just like painful intercourse for sure. I mean, if you have tearing after or during a delivery anyway, like that, again, that's an injury to the body. So scar tissue's going to form. Scar tissue lays down crazy quick and not linearly. And so, like, that's already kind of like a shortened, short tissue anyway. And then that leads to pain in and of itself. And so, that I didn't know. I had not heard of that. So.
Crazy. That was
So I'm going to say 100% yes without the research.
That was a topic I was introduced to by Mary Sinisarko.
Really? Oh my gosh.
It came up in our, was that like History Development or whatever? It came up in that.
Something about with her.
Yeah.
Yeah.
I feel like that's such a lore, Utica College lore, if you were a health studies or PT track. I feel like everybody had that class with her.
Yeah.
We cut to the chase on pelvic floor dysfunction and how to fix it. So, once again, I'm Maddy with Forte Strength and Fitness Training, and we had
Andrea, pelvic floor PT.
What's the name of your practice again? So people in Whitesboro area can go check it out.
Bold Move Physical Therapy.
Bold Move Physical Therapy. All right, we'll catch you guys next time.